I will focus myself on the North East of Syria, give you an overview about what's happening in the camps and what's happening in the prisons and also on the fields. Give you a brief overview. North East of Syria, it's 4 million people, 600,000 internal displaced population, now 9 out of 11 hospitals being damaged during the last years of war, basically with poor technical infrastructure. They had only 40 ventilators, 35 ICU beds. For Syria, what about COVID in Syria for the time being? We've been reported the first case on March 22, first fatality case on March 29, as a total case for the time being roughly 50. Why so much? Why so less, I would say? Well, only 1,200 tests has been conducted so far in the capital Damascus and very few elsewhere. While few numbers, absence of testing, obviously, absence of testing capabilities, even some donors like China, Russia, the US may send or going to send some test kits like masks, also gloves or respirators. One can also say that the use of the Syrian population or the warm weather could be as a reduction factor. Obviously, increased food price, panic buying like we had also in our countries, disrupted supply routes as borders remain closed with Turkey and or Iraq, slow replenishment of stocks and movement restrictions are symptoms affecting the poorest and the vulnerable people first. So let's go now within the North East Syria camps. So basically, we are going to speak about two camps, Al-Hol and Al-Roj, which are the two famous and most densified. You see some numbers now. Well, basically, following the October 9th, 2019 aftermath, almost all medical facilities were suspended in those camps. You can easily imagine what it means for camp like Al-Hol, where 65,000 people are kept and some are only women and kids. Even though we had also seen some transfer to the so-called third country nationals from Al-Hol to Al-Roj, it's still an overcrowded camp. The situation for detainees remains very desperate and homeless. Wave of panic sparks already as the coronavirus will start to spread within the camps. Is it already hard to wash their hands on a normal time if it's even harder now with the virus and the hygiene conditions being due? Due to this concern about the pandemic, few people may visit the camps again, so the medical treatment and basic health are very poor. As WHO stated, any areas with large group of people, such as camps and or cities, hosting mass gathering are of greater concern. And again, another aspect to look at are the illicit communication and exchange between the camps residents, the smugglers, and or ISIS fighters could easily exacerbate the spread of this virus. Let's look to and face the prisons now. And we are going to talk about Asake prisons for the time being. Sorry, here we are. So on an ongoing research that we are currently done with our two colleagues, Hafez and Faisal, as for the camp, prisons share exactly the same common denominator: vulnerability to non-existent health standards, therefore a vital ground for spreading the virus. Incidents has been recurrent in countries not maintaining health standards. Obviously, as disease develop easily with a constrained space, prisoners are an easy targets. On March 30, we had already a riot start in the Hasakeh prison, where 5,000 IS fighters are detained for the time being. You will see now the conditions where they are. In total, you have to know that SDF have 10,000 under their control. The surprising coincide with mounting fears across the region that the coronavirus will arrive in this ravaged area, but apparently it was also due to some of the detainees having tuberculosis, which is a common bad prison conditions. As SDF, IS fighters are in constant tension, analyzing project and explosion of the situation, especially as the COVID-19 will amplify the tension. It is a if, but might be a when. So what will be the strategy in the future for both IS and probably the intel services or the coalitions? IS will encourage its members and supporters not to show mercy to Western countries, but rather continue to attack and exploit their weakness in these times. Opportunity for them to also gain support, as sometimes corrupt, inefficient, poorly resources managed by governments fail to provide adequate care for already distressful population. So the COVID-19 has uncovered the weakness of those who claim to be the superpowers of this world, such as the US, UK, and or France. As some of those troops are now deployed and stretched in their capacities, if not reduced, they become easy targets, as those troops are already preoccupied with protecting their own population, even not themselves. So again, for ISIS, is the destruction seen as an opportunity. The virus handicapped also domestic security efforts and international intelligence counter-IS cooperation. The coalition is already pulling back from the fields, halting training activities, as well for the Middle East and or for the African military units. As for the intelligence community, it's also affected by the lockdown. So the strategic collection will be lighter, as one of the key challenges will be to attract human intelligence in area with active outbreaks, significant restrictions or travels. So we do have different scenarios as IS high-ranking members and leadership are taking COVID-19 seriously. They might be attacked. They may become more decentralized. So that means avoiding the foot soldier to have access to the main high-ranking members. Could be low-ranking members can fear contracting the virus themselves, so attacks could diminish. Or as we saw already in Mali a few days ago, attacks can be even more on the rise, as IS will then take the opportunity to embark in the fields emptied by the coalition. So this is it for my part, and I will take questions with pleasure. Thank you.